So here I'm going to start getting into a couple of case studies of people going through emerging adulthood. I'm going to use two people as an example. One is Sean and one is Pat. Now, the reason I'm doing this is because this will illustrate exactly how different paths you can take through something like emerging adulthood, because these two people are entirely different, although they're going through the same sort of developmental phase. And again, not everybody does. Some people are very comfortable just going into adulthood and don't need this emerging phase. But those that do aren't always going to be the same. They're going to need, they're going to have different challenges presented to them. So let's start with Sean. Now, Sean is 19 years old. He has a history of drug use since probably 11 or 12 years old. A lot of crimes associated with the drug use, doing things like drinking hand sanitizer or shoplifting in order to, acquire drugs or alcohol or whatever Sean could get his hands on. And so obviously he had a really hard time through junior high and high school. He barely got through high school and was pretty much carried through by his parents. Now Sean happens to be of fairly high socioeconomic status, very supportive parents, kind of spared no expense trying to help and treat Sean, who had multiple diagnoses, whether it's depression or anxiety or personality disorders. He went to a couple of inpatient psychiatric units a couple of times, detox, rehab, kind of the whole 9 yards. Now, after high school, he pretty much just kind of pooped out. He had a job in high school, saved a little bit of money from it, but then just started blowing through all his money, feeling kind of a lack of sense of responsibility. Tried to get other jobs, couldn't really stick to it, would often show up high or stoned or drunk, and so he kept kind of losing his jobs. And all his employers kind of got the impression that he didn't want to work. Now, if you ask Sean, he feels that he can't work. He has too many problems. He can't really contribute anything. He can't find a meaningful job. And without having something that's meaningful, it feels like there's no point in really even trying. Now, not everything about Sean is quite that negatively valenced. Sean is highly intelligent. He knows that he is very supported, but this is an example of somebody who is going through emerging adulthood because after high school, after kind of that chapter of his life is over, his plan was just to kind of not have a plan. That dream that Levinson had mentioned, he just didn't really have that. He didn't have that goal driving him towards these things that you would normally have in adulthood. So he wound up just living with his parents, who tried to support him as best he could, until eventually he got drunk and started getting violent, and then they wound up kicking him out, and then he wound up homeless for a while, and then wound up in kind of halfway houses and sober living houses and drug rehabs, and then eventually even wound up with his own, just renting a room at a boarding house. So, as you can see, the challenges that Sean is going to have are really a lot of that in-between feeling, where he doesn't really feel like he's belonging in the adolescent world anymore, although most definitely does not feel like he is an adult in any way whatsoever, which is, obviously a common theme. And his challenges are going to be finding a place to live, finding work, being happy in the work that he's in, because everything is just going to seem very unsatisfactory to him, and continuing to get the kind of mental health support that, as a pediatric patient, being with his parents, the parents can kind of constantly monitor that and make sure he's getting the mental health support that he needs. But once he's on his own, might not feel exactly equal to the task of kind of making sure he's getting all the mental health support that he needs. So now let's talk about the second case study, and this is Pat. Now, Pat is a little older. Pat is 22 years old. Her problems started actually at about the age of 19, when her father moved across the country for work or a relationship or something like that. And Pat had to decide whether or not she was going to go with her father or stay in the location she was at. Now, this is, again, a problem with emerging adulthood that most people don't necessarily have to face. She didn't feel equal to the task of just living on her own. She wanted to live with her parents, because that way she could save up money to go to college. She had just gotten a pretty decent job and a license to continue to do that job. And so she went with her father across the country to places that, she didn't know anybody. It didn't work out that well. The father wound up getting married to somebody who Pat did not get along with. So Pat went to college. The college didn't particularly work out. The grades weren't that good, and after a while, the financial support was cut off, and so Pat got very angry with her parents, and that helped sever a few more ties, because Pat felt that her parents were obligated to continue to support her financially, even though she had a full-time job that paid pretty well. But she felt that the money she was getting from the job was hers to keep so that she could go to college. Although, keep in mind, up until this point, Pat had her college paid for as well. She tried to pay her own way through college. That also didn't work out all that particularly well. She wound up homeless for a little while, and felt very despondent about the idea of getting her own apartment. And again, she had a job. The job pays well. It was a job that some people take as a career. And other people had, in that same job, her compatriots had apartments and houses and families and on the same income. But Pat didn't feel like, like that was feasible for her. She felt very hopeless in the idea of supporting herself. Pat was going to school to be an actress, but really just had a lifelong dream of being an actress, but only wanted to work with studios that she agreed with politically and that treat their actors very well. Now, Pat obviously has a completely different list of problems than Sean does, and Pat is a very hard worker. She knows that she has to, contribute to her own life. She knows that she has to work, but she doesn't feel comfortable in spending the resources that she is acquiring on things that I want to say sustain her life. Rent, food, that sort of stuff. She's at that stage where she feels that other people, family members, community services, that sort of stuff, should be helping her with these expenses. Not just helping, but completely taking care of them, so that she won't have to spend her own resources on it, even though she is a hard worker. Now, in addition, that she's also having a bit of a problem with the dream that Levinson was talking about, but in a completely different way than Sean was. Sean almost basically lacked having a dream. Pat has that dream. She wants to be an actress. She has these goals, this idea that she will have her own place and she'll have her own career and she'll be respected. But the dream is not particularly realistic. She the idea of being an actress who can pick and choose the roles that she takes based on whether or not she politically agrees with the studio is not particularly realistic. In the entertainment industry, you've got to take what you can get for the most part, and then just try to use that to get better parts in the future. In addition, she seems to have problems with the dream in the respect that she thinks that it's other people that are going to be giving her her dream instead of she's the one that's going to be earning the dream herself. And as far as resources go, both people are going to need drastically different resources, although in a lot of ways similar resources as well. Both people need housing support, whether that is a matter of giving them housing or low-cost housing or something like that. Both of them need support in I want to say home expenses, food, clothing, that sort of stuff. But beyond the financial, both patients need their mental health difficulties taken care of, although obviously Sean has many more mental health difficulties than Pat does. So that's really just a brief synopsis of a couple of case studies, just to give an example of the different challenges that are presented with each individual in emerging adulthood, and how, while there are going to be some common themes, like feeling that they're going to require financial support or housing or living assistance support, there's also going to be a lot of differences where some people are going to have a lot more mental health needs than another person. Other people might be very willing to work. Other people might be very difficult to work. Some people can keep jobs. Some people can't, depending on their social skills and the other problems that they happen to have.